It happened right after the birth of Catherine Leon's second child.
I had the classic heart attack symptoms. I had severe central chest pain. I had numbness in my arms.
Pain in the center of my chest that was radiating down my left arm and up into my jaw.
Laura Haywood Corey's heart attack happened at night, but both women, who were strangers to each other at the time, were fit, healthy, and had no risk factors for heart disease.
And I heard one of the doctors say, "Has anyone seen anything like this before?"
Laura and Catherine had what's called a spontaneous coronary artery dissection, or SCAD. A tear develops in the inside of a coronary artery, allowing blood to create a split between two layers of the wall. This may result in a loose flap of tissue on the inside of the artery. This flap, or a blood clot that forms in the damaged artery, can block blood flow and potentially cause a heart attack. Doctors in their hometowns told both women SCAD was rare, and there was really no information available about why it happens, who's at risk, or the best ways to treat it.
I felt like that's just ridiculous, and that's what prompted me to start looking. And through this Women Heart message board, I found people and just kind of collected their names for about 6 years.
Women who had the same condition. Catherine thought maybe SCAD's not as rare as they think.
Boom, one day here's this awesome post started by Laura,
who was blogging about SCAD.
So we were really excited to meet each other in person.
Both were searching for answers, and their quest didn't stop there.
Where's the research?
They went to Mayo Clinic, where at a conference, Catherine reached out to cardiologist Dr. Sharon Hayes.
Catherine approached me and she said, "Nobody's studying this disease. What is Mayo Clinic doing?" And I had to answer her honestly, nothing at that time. But I would look into it.
Dr. Hayes saw the data Catherine had collected through social networking.
She shared with me not only the existence of this group, as well as a very sophisticated research agenda of questions that members of this group who had suffered SCAD had come up with.
This information prompted Dr. Hayes to put together a first-ever pilot study to learn about SCAD.
Was thrilled when she emailed back and said, "All right, let's do it."
So we looked at this as an opportunity not only to better understand SCAD and this disease, but to test away using a social media group, essentially a medical Facebook group, to come together, self-identify, volunteer for the study, and see if we could get enough information from that group to make conclusions.
And from those conclusions, the goal will be to eventually give doctors and women the information they need to prevent and treat this potentially deadly condition.
The unknown is just awful, and if I could prevent someone else from having that, that would be a life's goal accomplished.
All thanks to the initiative of two women and the willingness of a doctor to listen. For Medical Edge, I'm Vivian Williams.